So we've got our patient coming in today with a really bad ingrown nail. So kind of the typical thing that we usually see, we see that we've got a really swollen and red nail border. You can barely even see the side of the nail. It's all dug inside. The patient's been dealing with this for a while. He's been working through it. It's painful. So he finally decided to come in and we're gonna take care of it. So the patient's already been on antibiotics, which treated the local infection. We've already cleaned off the toe really well. And of course, the patient's been numbed. So we've already numbed up this toe, so he's not gonna feel anything, at least we hope, right? So we'll definitely check to make sure that he passes the numb test. Okay, so you'll let me know if you feel this, okay? You shouldn't feel any pain. You're gonna feel me touching you and you'll feel some pressure, but no pain. Any pain?
Nope.
Okay, he passes the test. So we are ready to proceed. So like we've talked about, if you followed my videos, we use a variety of different instruments to be able to get rid of that ingrown nail. We use what's called a freer elevator to lift up the side of the nail. So what we do is we just very carefully lift the cuticle and the nail fold from the actual nail plate that's digging into the side of the nail. So you actually feel a give of the freer, which tells you that you've made it all the way back. And it's really a feel thing. And we're doing the top first, and then once that's all freed up, and you can see how deep that freer is inside there, right? We come with the other side, and we go underneath. And the same thing here, you start to feel a give, and then the freer goes all the way back. Again, you can see how deep that freer goes underneath the nail. Okay, so both sides of the nail are freed. Now we come in with our other instrument, which is called an English anvil nail cutter. I guess it looks like an anvil if you look at it. And this is a sharp nail nipper that you can sneak underneath the portion of the nail you've already cut. That's that beautiful sound. And you go all the way back until you don't feel that crunching, which means you're at the end of the nail. Then you pull it out. Then you come in with your third instrument, which is your straight hemostat. And this is what you use to go all the way down. You clamp it, and then you turn it away from the nail fold. And it comes all out. So that's what comes out. And what we look for is, you can see this portion of the nail is the nail matrix that came out with the nail. I always like to do a few passes with the hemostat to make sure that everything is out, and it is. So there you have it. The entire nail is now out. Now what you can see is, with the nail being out, once this heals, it's going to look like a normal nail. Even though it's going to be a little narrower, he still has plenty of nail for it to look pretty normal. So now we come in with our phenol, which is the chemical agent that we use to cauterize, or essentially kill, the portion of the matrix, which is what produces the nail, so that that sliver of nail doesn't grow back. We use 3 applications, about 30 seconds a piece. A little goes a long way. So after we go into the phenol, I always like to dab off the excess. I'll come in and I'll cap the phenol, because we certainly don't want to spill that. We'll put it over here to the side. And then we take our cotton tip applicator and we go all the way down into the matrix. I'm turning this towards the nail, which prevents the phenol from getting underneath the healthy part of the nail, because we don't want to affect that. We just want to target the actual portion that was ingrown. So I'm counting in my head about 30 seconds. Doesn't have to be exact, but you can see how far the cotton tip applicator goes in to kill at the root. And then sometimes you get a little bit of this skin fold that gets stuck inside that we have to cut out. So far, have you felt anything?
Nope.
No pain?
No.
Okay, there you have it. No pain.